Hi, I'm Uliana. I am a registered physical therapist assistant and a senior healthcare administration student at Baker College. In the recent years, hospitals and other healthcare clinicians were losing positive healthcare delivery reputations and major finances as hundreds and thousands of Medicaid and Medicare insured patients were facing unplanned readmissions across the nation. Readmissions are not new to society, as patients constantly go home and return to their doctors with the same health conditions that were thought to be in control. Medicare's $17 billion payments were accounted for as readmission rates. These preventable expenses had captured much attention on the Capitol Hill before 2010. Obama administration implemented a hospital readmission reduction program under the 2010 Affordable Care Act in hopes to link the hospital reimbursement payments to the quality of care. This is a pay-for-performance program which lowers inpatient payments to hospitals with many readmissions. Essentially, when there is an unplanned admission within a 30-day period of a discharge, the hospitals must treat the patients basically free of charge or for a fraction of the charge. With the passing of readmission reduction program, hospitals must now find ways to lower their readmission rates to avoid the severe financial penalties. This is a big sting for businesses. Not only are there public listings for penalized hospitals, but it is a poor reflection of hospitals' ability to provide quality care. Joining me today is a Central Ohio Health Systems Pharmacy Revenue Integrity Analyst. Nick, thank you for joining me.
Hello.
And please tell me what your work history is like in the healthcare field.
My work history includes working in cardiology for about a year, working in radiology for about 5.5 years, and working in pharmacy administration for the past 1.5 years.
Nick, what is your input on hospital readmission, and how has the issue affected your role as a leader? And how is your healthcare team tackling this issue?
So readmissions, that is a big issue for all hospitals and our hospital as well. Something that we are doing in pharmacy is we have a meds to beds program that we're implementing right now. It will help keep patients on their schedules for taking meds. It also just helps guarantee that the patients have the meds when they leave the hospital. That's important because a lot of patients, they walk out the door, they feel fine, and then they think, oh, I don't need my meds. And then, come, a week later, they're back in the hospital because they never took their meds, because they never went and got their meds.
In 2019, 2,573 hospitals were penalized for soaring readmission rates. The insurance programs will withhold over $500 million of reimbursements from many hospitals.
So that is, has a big impact for us when we don't have patients coming back to the hospital as a readmission. Big impact on revenue for our pharmaceuticals.
In 2015, many health clinics faced 1% Medicare reduction payments for hospital-acquired conditions. Examples of these conditions include bed sores, catheter-related infections, and other preventable issues. Thank you, Nick. I will be looking into the Meds for Beds program in the near future.
Thank you for having me. Goodbye.
Not all hospitals are automatically enrolled in this program. Over 1,500 hospitals across the nation are exempt. These include the children's hospitals, the VA, the psychiatric wards, the critical access hospitals, and all the hospitals in the state of Maryland. Financial penalties apply for the following 6 conditions: acute myocardial infarction, COPD, heart failure, pneumonia, total knee and total hip replacement, and coronary artery bypass, known as CABG. Hospitals are penalized even if there's one condition out of the 6 that are showing high readmission rates. This is an issue for hospitals who serve the poor communities, where patients do not have proper access to healthy lifestyle, diet, or even a doctor. This concern has been raised, and it will be addressed in 2019 when hospital penalties will be calculated based on performance compared to hospitals with the same number of Medicare and Medicaid insured patients. One potential way to reduce hospital readmission is to implement a post-discharge care program. On several occasions, once a patient is discharged with the mindset of being healthy, it becomes really easy to ignore the doctor's orders. And this program may include educating the patients on why it is important to finish all the medications, even though the pneumonia symptoms have vanished. Many hospitals are turning to advanced technology such as psychographic segmentation and digital communication to manage their discharged patients based on their unique motivation and attitude to health. It's a nice way to check up on patients and motivate them to take medication and to continue their plan of care after they've been discharged. So what does the future look like for the issue of readmissions? So far, we know that establishing penalties seem to have shown improvements in hospital quality of care. Based on the data analysis of over 3,000 hospitals, between 2007 and 2015, decline from 20.5% to 17.5% of readmission has been very promising. So hospitals will strive to take advantage of technology and take advantage of targeting both conditions that are on the 6 list and the ones that are not to improve their readmission rate. The hospitals could even get better as healthcare professionals establish their communication and healthcare approach strategies. Establishing a good rapport, for example, with patients is one way a patient-provider trust will be on a whole new level. The readmission program still has more flaws and will continue to be rewired to fit the desired healthcare outcomes. We know for certain that readmission rates are lowering, and the future is looking a lot brighter with advanced technology and proper communication strategies that are being implemented across the hospitals in the nation. The more one understands, the more likely they are to take charge of their own health.